Good afternoon and welcome to UnitedTV and Bariatric Friday. My name is Kemal Erkan. Today we are going to have another episode on Bariatric Friday, and Dr. Irgau, as Irgau is going to join me, and we are going to take a closer look at a topic that many post-surgery patients ask about, intermittent fasting. And Dr. Irgau is going to educate us with this method and how we actually utilize this in our bariatric program. And I know other people, not patients necessarily, who are struggling with weight loss, maintaining their current weight, and also upcoming holiday season. So many people are going to need different methods, and I think intermittent fasting works very well if it's done correctly. So, Dr. Irgao, how are you doing?
I'm doing great. It's great to be back after a relatively long hiatus,
Right. So
actually.
we
I've been
miss you.
having
So
withdrawals of Bariatric Friday, so
absolutely.
it's
So
great to be
we
back.
have two new surgeons. We introduced them.
I saw that. That was wonderful. Yeah,
It
thank
was
you.
something different for us. So because we don't have a lot of new surgeons all the time, and with CRIAS and American Surgery Center, and for United Medical ACO, adding more bariatric and general surgeons are important, and we know that.
Absolutely.
And
Absolutely.
now it's amazing that we have brand new people
Yeah.
started with us. So, and we'll have two other locations pretty
Yes,
soon,
absolutely.
and
Absolutely.
one of them in Middletown, and the
Yes.
other one is going to be in Hawkesson,
Yep.
and we'll be able to reach out to more patients, or patients will be able to reach out to us a little bit more uh, conveniently,
Yeah,
hopefully.
absolutely.
And
Absolutely. That's great. That's
so
great.
now, the intermittent fasting is extremely popular as we've been covering this. We did so many episodes on this, and pretty much alternates between fasting and eating periods. And now, if you can actually tell us what exactly is intermittent fasting and how does it work in terms of metabolism and the fat loss?
Yes, thank you. So, intermittent fasting focuses on when you eat, not just what you eat. The vast majority of approaches to improve nutrition and metabolism very often will focus on what you're eating, but intermittent fasting is really focused on when you're eating. And by having prolonged periods of fasting, we know that insulin levels fall, and this is an important concept because very often one of the problems we have with obesity is insulin resistance or
Hmm.
consistently high levels of insulin, which, as you know, is a hormone that encourages storage of fat as opposed to utilization of fat for energy
Right.
levels. So fasting periods decrease the insulin levels, and that will encourage the body to burn fat as opposed to store it. And that leads to improvement in the metabolism, weight loss, and overall health of the
Hmm.
person. When I look at it, it's actually the perfect antidote to the problem we have in our society, where one of the main issues is pervasive availability of food always and everywhere. I went to the bank this morning, Kamal, and as I got into the lobby, on the table on display on the right side, they had pretzels for people to serve themselves.
Right.
And then as I
Candy
approached,
box.
that's right. And then as I approached the counter, they had lollipops in a bank, right? You don't go to the bank to eat normally, and yet they had food there. And you would think, wow, they have food because people come in starving. Not at all. We are in a society that nobody is starving, really. So having food all the time and munching all the time and is one of the problems we have. And therefore, you can see how putting some kind of guard as to when you're eating is an important way, really, to combat the problems associated with overeating in our society.
So the access of food is, I don't know if we are going to be able to ever solve that problem. It's still the way of showing your appreciation for
Yes.
others and pleasing others, and you know, they bring chocolate from when they go somewhere else. They bring cookies and pretzel. Like pretzel is one of the worst thing
Absolutely,
uh,
absolutely.
you can have. So
I mean, you and I were at the top doctors event from Delaware today last night,
yeah,
where
yeah.
the top doctors of Delaware were invited to this event, and I was very, very happy to see many of our Koreas and
So
United Medical
the
doctors
entire Korea
represented. Yeah,
doctors and
entire
surgeons.
doctors were there, being voted best doctors in Delaware. And well, as soon as we got into this beautiful hall, there was this large display of all sorts of foods.
Food.
And, whether you've had dinner before or you're about to have dinner afterwards, there it was. So, as you say, this pervasive availability of food is a way for people to show appreciation. And yet, of
Right.
course, the drawback is what we see as well.
Now, with the Top Doctor event, I think it's fine because it's an event. But I think the issue, like you just described with the bank, like you go
Yeah.
to a bank and then why do they have food? Why do they have pretzel? Like no
It's
one is
me.
going to go to that bank because, oh, they have pretzel, so let me deposit my money there, right?
Well, I mean, I'm sure they have marketing people who've studied and say, hey, if you put pretzels, maybe more people will show up. It shows you that
Well,
what kind of
I
mindset we
never
have
choose
in
a
our
bank
society.
based on the pretzel service. So, but this is again the way that we want to please. We think that you need to taste this, you need to have this,
Mm.
and all the unhealthy choices.
Oh,
So
totally, totally.
um, they can have robot products, and then that protein bars. There are ways to make it healthier, but no, the always the unhealthy. Like at the airport, that place I won't want to mention name, but the pretzel place that smells so goddamn good, and I'm like, every time I go to the airport, I have to have some
Yeah.
because the smell just takes you over.
Oh,
And
absolutely.
then I have issues later on because I have gluten allergies. If I eat too much of it, it's a mess.
And it's a small place, so the smell will be everywhere.
Right?
So everybody's
It's
attracted to that place.
it's a mess. So bariatric surgery changes the digestive system and then hormone balance
Mhm.
in ways that can resemble the effect of the fasting, particularly on the appetite and the insulin responses.
Mhm.
So,
Mhm.
from the medical perspective, does bariatric surgery already simulate some of the same metabolic effects of intermittent fasting?
Yes, yes. So after bariatric surgery, the hunger hormones like ghrelin decrease, whereas the fullness hormones, the satiety hormones, the good hormones like GLP-1
Mhm.
or PYY tend to increase, giving a much better blood sugar control and improved efficiency in terms of utilization of the fat
Mhm.
stores. So these hormonal changes actually resemble what happens with intermittent fasting, and no surprise, both of them can result in improved health and weight loss.
So, the one of the again early after surgery patients must focus on hydration and nutrition intake for healing. Fasting during this period can cause serious imbalance in some ways. So, at what stage after bariatric surgery, if any, can a patient safely begin the intermittent fasting?
That's a very important question. So, I would say in the first year after bariatric surgery, intermittent fasting should not be attempted.
Hmm.
And the reason is twofold. One, it's not necessary. That is actually the time of rapid weight loss, rapid improvement in many of the indicators of metabolic disease. So, really, it's not necessary. But there is a downside to it as well, as you mentioned, and that is because the intake overall tends to be a lot smaller early after surgery as well. Practicing intermittent fasting can lead to deficiencies at that time, particularly in terms of dehydration, decrease in protein intake, decrease in vitamin intake, which are extremely important elements of the health of the person in a time of rapid
Hmm.
weight loss. As we always talk, when people look at the results after bariatric surgery, you will see that the highest weight loss will occur actually in the first 6 to 12 months. it's a period of fairly important instability, if you will, on the overall hydration as well as nutrition of the person. That is a time in which the person needs to be monitored very carefully to make sure that they're obtaining adequate hydration as well as important nutrition, especially from protein intake as well as vitamin intake. So that would be the wrong time to try to introduce a method that would really decrease the amount of nutrients that they are going to get, which is what happens with intermittent fasting. So if intermittent fasting is to be considered, I would say do it maybe after 12 or 18 months after bariatric surgery. But even then, it should be done under medical supervision.
Many people, as you said, many people already are losing a lot of weight.
Substantial amount
So
of
the other
weight.
day,
Yeah.
one of the follow-up patients from our practice, 12 months later, she's 110 pounds. She lost that in 8 months. 110 pounds. Like, I don't know if I use Faith as an example, but she's probably 110 pounds, right? 120? You need to lose 10 pounds. Intermittent fasting would be good. So, I mean,
That's the whole person.
Losing the whole person,
Yeah,
right?
yeah,
This is amazing.
Yeah.
So then they don't necessarily need it, but we use more on the pre-surgery
Yes,
because
yes.
we had one of our patients with BMI 66. It's a male patient, needs to be at BMI 55 for the best outcome, and and we have, like, let's say 2 months to bring that person to the surgery. And I know with certain ways, and intermittent fasting is one of them, that makes it, that motivates the
Possible,
person.
yeah,
It
absolutely.
makes it possible.
Yeah.
Now, there are different types of intermittent fasting, 16 to 8, like 16-hour fasting, 8 eating, 5 to 2, 5 days eating normally, and 2 days with restrictions, and alternate date fasting. And I do this and you do this. Sometimes I do it wrong. I know that sometimes you know, we don't count eating, let's say, fruit after 9 p.m. Let's say at 11, if I had an orange or like apple, that still ruins that fasting.
It does. It does. Yeah.
And since our last time we covered this, I'm being more careful with that. Now, one thing that I don't understand, when you start doing this, like, let's just kind of off script talk about this a little bit. So when I eat, and I also know to control certain things that comes after eating. So, and if someone just eats all day long, periodically, like every hour, they have something. So that shop, their stomach, is never closing and constantly just doing the same thing
Yes.
all day long.
Yes. Yes.
That's,
That is the
if you
problem
think-
we have. That's
if you
the
think
problem.
about it, it's
Yeah.
pretty crazy.
Yeah. So the only time a person in that situation where they are not eating is when they're asleep.
Right.
Although some people do get up in the middle of the night and go after
Binge eating.
after whatever there is in their fridge, and worse, some people may have a fridge in their bedroom as well, which
Oh
is
my.
even worse, right?
I haven't seen that yet.
But that is precisely the problem in our society, is that there is no closure time for eating unless you're asleep. You know what I'm saying? Which means that you're open for business. You get up, right? You go down to the kitchen and you will eat something and then it may be breakfast, and then you may be going to your office, and then on the office desk you may have stuff that you may be munching on continuously, and then maybe there is a break. When you go for a break, the break room will have some food as well. Then you go back to your office and you continue that, and then there is lunch, and then the whole process is repeated in the afternoon until you go home. You go home, you have your dinner. After your dinner, you relax. But what do most people do when they are relaxing and, for instance, watching TV? They will be munching on something. So that example that you mentioned is not far from reality for the vast majority of people.
I see.
And it's not that they are doing it knowing that they're hurting themselves. It's that the way our society is structured right now encourages that. So it is not surprise that obesity levels have risen so much, so quickly in our society, right? In fact, I would even say it is surprising they're not higher than what they are. If you really look at how we're constantly eating, essentially.
It is already probably higher because what we are reporting is the one that we have data on.
Yes.
So how many
Yes.
people don't have their doctor's appointments?
Absolutely.
Their annual physical. How do we know what their weight is?
Absolutely.
Right. So this
Absolutely.
is from the people who come to their physicians and provider offices,
Absolutely.
and there are from the ACO, United Medical ACO side. So we have to force the patients to do their annual physical.
Absolutely. 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 So based on that, even if people, we will go into in a little bit of what types of intermittent fastings there are, but even if people practice a simple discipline of saying, okay, I'm just going to have breakfast, lunch, and dinner, and nothing in between, or if they say to themselves, after I have dinner, after a certain hour, I am not going to have anything and I'm going to go to bed. If they practice that, that is actually one form of intermittent fasting, if you think about it, because the concept is we're saying, look, eat when you're eating, but don't eat when you don't have to eat. Just stop doing that. No casual putting stuff in your mouth continuously, because that is keeping your insulin level high. When the insulin level is constantly high, the body becomes resistant to it. And when the body is resistant to insulin, that is actually the definition of type 2 diabetes, which means the insulin is incapable at its current level of getting the blood sugar to get into the cells. That's the definition of type 2 diabetes. And you are making that happen by keeping the insulin level constantly high by munching continuously, right? So just avoiding that will lower the insulin level and will decrease the risk of type 2 diabetes, essentially.
And when we add other things into this, I want to make sure that our audience, they take advantage of our nutritionists who are on board. They are dietitians, nutritionists, licensed, and there are so much to learn. And one of the things, even understanding, this goes with the intermittent fasting, in my opinion. So when you look at how much certain food stays in the stomach. So if you eat fruit at the same time you have protein, now you are mixing fruit that should only stay 1 or 1.5 hours. Now with the protein that's going to stay more than that, and now that's going to interfere with what protein is supposed to be doing, and then something that healthy becomes unhealthy because we didn't eat it at the right time. So when we have this discipline of, and we are not saying that our body should only be like doing this all week long. So it should also know how to deal with unexpected situations. So that can be your cheat time. So because if you always eat healthy, it may actually, because it's too smart and it just learns things. It's like the AI that's generated already. It's already in there.
Oh yeah,
So,
it's the most sophisticated AI we have so far, right?
But it has a bad mind. Like it just learns, and then once it's comfortable, it does something else. Or when it gets too comfortable, then it doesn't know what to do when the unexpected situation happens. So this is as I get more research, study, reading done, it just makes perfect sense. So that it will fix a lot of problems altogether if we do this with better understanding what foods that should be mixed together and what shouldn't be.
Absolutely.
And our dietitians would be the best one to help. Now, from bariatrics patient standpoint, what do you think most suitable ones for the type of intermittent fasting? Like I try to do 5 days, 14 to 16 hours. Today I did 16 hours, and I don't know how you were away for a little bit, so I don't know if you were able to do it or not. But are you back on the intermittent fasting
I'm
now?
back on track, but when I was away, I did not do
You
it. I have
didn't,
to
and then you did
confess.
like five, like you do 5 to 2, like the
Yeah,
5 days.
generally I do. Yeah,
Weekdays are
yeah,
easy to manage.
yes.
So, what's the best for the bariatric patients?
So I would say for bariatric patients, it's always best to stay on the moderate type of intermittent fasting, which means that you would have, for instance, a 12 to 12, right? Which means that your eating period should be between 8 a.m. and 8 p.m., right? So that the 24 hours, you've broken it into 12-hour cycles, essentially, the 12 hours where you will be eating, and then the 12 hours when you're not. Or you could do a little bit more aggressive than that, where you could say 14 and 10, which means that you may be eating, between 8 a.m. and 6 p.m., for instance, or 10 a.m. and um, 10 and then 8 p.m. And that will give you a little bit of leeway. Doing something more aggressive, like 6 and 18 or 20 and 4, that may be too much for bariatric patients, because the shorter period, for instance, if you were doing like 18 hours of fast and then 6 hours of eating, it means that you have to utilize those 6 hours to cram every nutrition that you need. And bariatric patients are not suited for that. They need a much larger period of time to introduce all the nutrients they need, simply because their digestive system now has been restricted by the surgery, so they cannot cram everything they need over a short period of time. So for bariatric patients, I always say it is best to have a more moderate type of intermittent fasting. And the key really that I am going after for bariatric patients is I'm trying to get them away from a habit that could be really a danger for post-bariatric surgery patient, and that is grazing, right? They cannot eat a big meal at one time, but if they graze, right, munching all day long like the sheep do in the grass, right? That is the most dangerous thing, because you are eating small amounts, but because you're doing it so frequently, you end up getting so many more calories in. And beyond that, you may not be fully aware about the quality of the food you're eating as well, because you're just grazing continuously. So to take them away from that, I think in implementing some type of intermittent fasting schedule is very, very important. But for bariatric patients, as I said, it should not be very aggressive. Moderate type, like 12 to 12 would be good, or maybe 14 and 10 would be another one as well.
And again, these numbers shouldn't scare anyone, because if you stop eating around 9 p.m., which you should, and if you can go through until 12 noon, that's 15 hours.
Yeah.
And
Yeah.
that's so easy to do.
Yeah, that's actually a reasonable.
Right. Now, I'm going to
Fine.
go to skip a couple questions up, and then want to go to the metabolism, and what this fasting can strain metabolism, and if it's important to recognize warnings, signs earlier. Ignoring symptoms can lead to serious complications. So, what are the key red flags that indicate intermittent fasting may not be safe for those patients who had bariatric surgery?
So essentially, you will have all the symptoms of deficiency or potentially dehydration as well. So that could be dizziness, for instance. They could have weakness, they could have low blood pressure, they could have dehydration, they could have fatigue, or they could have things like hair loss as well. All those are red flags suggesting that the body is telling you, hey, I need help. I need more water, for instance, or I need more protein. So if any of those symptoms are occurring, it's important for people to get help at that time. So, and there are patients who are more likely to be vulnerable to this than others. So patients who have, for instance, still some degree of diabetes, where the blood sugar control is not optimal, and they need to have medications still to address that. Patients who suffer from events of low blood sugar, which is known as hypoglycemia, those are obviously patients who are more vulnerable to having problems, right? And then, of course, on the other hand, if you have patients who have a tendency towards eating disorder, problems, they also should stay away from this, essentially. That is why we're saying this is not something that, you should go home and say, I'm going to do this by myself. We're talking obviously about our bariatric patients now. So if bariatric patients, if they want to implement some type of time restriction to their eating, it is important that they do this in conjunction with their surgeon and also with their nutritionist, and that they are very, very quick to let us know if they have any of those warning signs that I mentioned. Yeah.
Now, for those pre-surgery patients, so one of the things that's important for them to coordinate everything through their surgeon.
Yep.
Surgeon is the anchor for the entire process. And then we have, if we believe that patient needs to do intermittent fasting based on the orders that we receive from our surgeons, then we have a patient get the education, then we make sure that our nutritionist is aware of what needs to be done, and we have our bariatricians who are also seeing these patients at least once, and in some cases we may need to do that more than once if the patient needs more support. I don't know if I told you this. This patient that I'm following, my success story of care coordination, 72 BMI, is scheduled in November. So she was 490 pounds and now down to 418.
Wow, that's pretty impressive.
It is.
That is pretty impressive, yeah.
But what I have seen on that patient's case is that number of times that we have seen the patient,
Right.
the nutritionist, and
that's key.
and then we become really close now. So then we follow. I mean, I know her very well, but it was amazing. I think it's one of the, again, most rewarding part of this work for me. When you won't get that type of satisfaction from any other business,
I agree,
other than healthcare, probably. So you may not be able to help yourself, but then you are able to do it for others. And she lost 80 pounds with our diet.
Well, I mean, that's why we're so fortunate to have you as our business leader, because you're not just bringing your business savviness here, you're bringing passion to it as well, because it is something you are passionate about, and that's critically important for us.
I really enjoy doing this. So, and now we want to make sure that our patients understand that please don't do these. Now, if you're not a patient, the best way to coordinate this is with your primary care. But if you are already in our program, make sure that this order comes from your surgeon, and then we can coordinate it, because we have several nurses as care coordinators. They can guide you and make sure that you have the proper support that you need. And the part that's extremely important is the post-surgery. Please do not do anything on your own unless the order is given by your surgeon in those cases. Now, for today, Dr. Erkan, my last question for you is, I know you were one of the first people implemented this in our program.
Yes, absolutely.
And,
absolutely.
For the patients, I mean, we started doing it, but then we said, the patients can benefit from it.
Absolutely, yeah.
And now it becomes part of our clinical order when it's needed. So tell us about some of the success stories, or if there were any complications that you encountered with any of the patients recently.
So really, success is possible when fasting is applied carefully, right? When there is really a good understanding from the patient's perspective of why we're doing it, and then how it's done, but how it's also individualized, right? Because particularly for post-bariatric patients, we have to talk about timing of supplementations. We have to talk about hydration goals. We have to talk about prioritizing protein intake. These are key elements. And as long as this is followed, you see success, you see patients being very happy. And also, they take really a lot of satisfaction in their ability to implement habits that take them away from temptations with which they have struggled for so long, right? So saying to themselves, right, this is not my time to eat. Yes, the office is having a luncheon today, but that's not going to be for me today. And they are able to move on from that. That satisfaction really is reflected not just because they are losing weight and they are improving their health, but also because they are happier, right? Now, complications occur, conversely, when these are not followed, when you have things like dehydration, when you have malnutrition, vitamin deficiency, hair loss, and other potential problems that can occur because the intermittent fasting is being applied wrongly, where the necessary nutrient that the bariatric patient needs is being crammed over a very short period of time, where often it's not going to be successful, right? And then if they're not able to get the hydration, the nutrition, the protein, the vitamins they need, there will be obviously consequences.
Absolutely.
So the success occurs when there is good coordination and cooperation between the healthcare giver, whether it's the surgeon, the nutritionist, and the patient. And obviously, problems can arise when this coordination is not there.
All right, so we try to cover the intermittent fasting for those who are going through a bariatric program, or if they have post-surgical need for intermittent fasting, but also for those who are not, who don't have morbid obesity, but they have issues with their weight gain and maintaining their weight. This is a great way to understand and learn about what you should be doing. We have done other episodes with this, and make sure you watch all of them because we are providing different information. There may be some overlapping, but we try to give different examples and different cases. So it would be important to watch all, but no matter what you do, please do not start these on your own. Make sure that it's there's a medical guidance, and also especially proper nutrition support in place. And we try to make this easier for our patients as much as possible. So Dr. Irgau, welcome back again.
Thank you. Thank you. It's great to be back.
Have you. And that's all we have for Bariatric Friday today. We are going to be back next week with general surgery coverage, and we haven't done that with you recently.
We haven't, yeah.
And knowing the services available from our CRIAS doctors, it's going to be important. So then we are going to do that next week. And until then, please stay united. Bye-bye.
Thank you. Bye-bye.